So, one thing we were able to do with our networks of care approach is we can consider a number of comparisons between different groups of young people. And so, a couple of those I'm just going to pick out now that we've looked at are comparison between neurodivergent and neurotypical, ever excluded or never excluded from school, gender conforming and gender non-conforming, and those who've ever had special educations need support on which we're going to call SEN or no SEN. So what we end up with is these pairs of networks, and we can compare them side by side and look at changes in the patterns of accessing different types of support. Now, I don't want to get all statistical, but we have to have a smaller side. When we were asking people how helpful they found these services, essentially we've binarized that into helpful and not helpful. And so when we say helpful and not helpful, that's essentially a proportion from that binary response. But when we talk about things being less helpful, that doesn't mean they might not be not helpful. Oh, that was a bit of a twist. So we just have to be careful when we say things are less helpful. That doesn't mean that young people aren't, on average, finding them helpful.